The information in this video is provided for informational and educational purposes only. Hey everyone, welcome to the Morale Monologue. I'm Michael Morale. In today's episode, I'm going to share a video that I put together for my physical therapist Emily, where she demonstrates some of the exercises that we do for the muscles in both of my hips. In the video itself, we not only demonstrate how we do these exercises, but some of the benefits that I've seen since beginning these exercises, and the benefits may surprise you. But before we do that, please listen to a word from our sponsor, and then I'll go directly into the video itself, which is about 3.5 minutes in length, and then after that, I'll come back and I'll give you my final thoughts. Thank you.
This vlog was made possible by a sponsorship from Avexis, a clinical-stage gene therapy company relentlessly focused on bringing gene therapy out of the lab and into the clinical setting for patients and families devastated by rare and life-threatening neurological genetic diseases. To understand how gene therapy is changing the way we see genetic diseases, check out exploregenetherapy.com, www.exploregenetherapy.com. Explore Gene Therapy is a resource for learning more about gene therapy, including its history and how it is being studied. Visit www.exploregenetherapy.com.
In mid to late 2018, I was diagnosed with severe muscle and nerve damage in my right hip and leg. This damage was caused over the course of my life while sitting in a wheelchair. As I've aged, the muscle and fat in my right hip and buttocks has virtually disappeared, leaving me to sit on bone and nerves. I go to physical therapy once a week, and on the first and third weeks of the month, we work on these muscle groups while I'm on the therapy table, and on the second and fourth weeks of the month, we work on these muscle groups while I'm sitting in my wheelchair. My physical therapist, Emily, has been working with me for nearly 1 year to help stretch and flex these muscles in both of my hips, and the exercises that I'm going to share with you today in this video will demonstrate how important these exercises are for anyone who sits in a wheelchair for as many hours as I do. In the first 4 pictures, Emily is working to stretch the muscle in my left and right hip while I'm in my wheelchair. By placing my foot flat on a footstool, which is located in front of me, this elevates my leg slightly higher than its normal sitting position. Emily will then put the opposite leg across the one that is supported by the footstool in a cross-legged or figure 4 position, making sure to support my foot with one hand. She then presses in a downward motion on my knee, which stretches the muscle in the side of my hip. After pressing in a downward motion for about a minute, Emily will allow me to rest and will repeat this exercise 3 or 4 times. Next, Emily will push my foot slightly closer to my body, and while supporting my foot, she'll lift my knee closer to my chest, which further stretches this muscle. Like the first exercise, Emily will continue pushing my knee toward my chest for about a minute, and then after allowing me to rest, will repeat this exercise 3 or 4 times. This motion of stretching the muscle, allowing it to rest, and then repeating the exercise ensures that this muscle gets fully stretched out. In the next 4 pictures, Emily is performing the same exercises, only this time I'm laying on my back on the physical therapy table. By transferring me out of my wheelchair to the therapy table, Emily is allowed to work these muscles while they're in a non-weight-bearing position, which allows for better stretching and flexibility. With one foot flat on the therapy table, located as close to my buttocks as possible, Emily will then place the opposite leg over the other in a cross-legged or figure 4 position. After making sure that this leg is supported properly, Emily will then pull my knee closer to her body, which stretches the muscle in my hip. In the last 2 pictures, Emily will either lift my leg and push it closer to my body, or she'll place the leg on a therapy cushion, which will pull my leg closer to my body. By doing this, she's actually able to work the muscle in both hips at the same time. Once both legs are in the proper position, Emily will pull my knee closer to her body, stretching the muscle in my hip. She'll continue to pull my knee closer to her body for about a minute, then after allowing me to rest, we'll repeat this exercise 3 or 4 times. These exercises have proven to be extremely beneficial for me, and over the past year, the muscle in my hips have felt much better, allowing me to sit in my wheelchair more comfortably. Physical therapists can also instruct caregivers how to do these exercises while the patient is at home, which should help the patient between their physical therapy appointments. While these exercises have proven to be beneficial to me as a patient with SMA, physical therapists can use these exercises on anyone who sits in a wheelchair for the majority of the day like I do. Being more comfortable in my wheelchair and not going through the pain that I went through every day has improved my quality of life. Okay, so I hope you enjoyed the video, and I hope you got some information out of it that you can use as well. If you're taking physical therapy like I am, I urge you to talk to your physical therapist and include these exercises in your workout routine. I think you'll see some benefits, just like I have. Hey guys, if you enjoyed this episode of the Morale Monologue, give me a thumbs up and subscribe to the SMA News Today YouTube channel. When you subscribe, make sure that you click on the bell icon. That way you'll be notified of any new videos that we produce. We at SMA News Today hope all of you have had a fantastic day. Do me a favor, this upcoming week, do something for yourself that's going to make you a better person. Until next time, take care of yourself, and I'll see you in a couple of weeks. Bye-bye.